My name is Kelsey. I'll be your student nurse today. Could you please verify your name and date of birth, please?
Melissa, November 672.
Okay, good. I'm going to do a head-to-toe assessment. I'm going to start with your head and inspect your scalp for any abnormalities, lesions, depressions, or hair loss. Okay, I don't see any. Next, I'm going to test your cranial nerve 5, your trigeminal nerve. If you could shut your eyes and tell me when you feel this.
Okay.
Okay. Next, I'm going to assess your cranial nerve 7, your facial nerve. For symmetry, if you could smile for me. You know, poof out your cheeks. Okay, good. Now I'm going to inspect and palpate your sinuses. Just tell me if you feel any pressure. This is your maxillary. This is your frontal. Okay. Next, I'm going to inspect your eyes. They're bilaterally symmetric. If you could look up for me. Okay, your conjunctiva is pink and moist. If you could look down. Okay, that your sclera is clear and moist. Now I'm going to inspect your pupils. Okay, pupils are equal, round, and reactive to light. If you could follow my pen, please. Okay, they also accommodate in each eye. Now we already tested cranial nerve 2, your optic nerve, for your vision on the Snellen chart. You scored a 20/20. Next, I'm going to inspect your nose. I don't see any abnormalities, and it's midline. If you could look up for me. Okay, your mucous membrane is pink and moist. I don't see a deviated septum, no polyps. All right, I'm going to check for patency. If you could sniff for me. Okay, now flare your nostrils. All right, now I'm going to inspect and palpate your ears. Let me know if you feel any tenderness. I'm just checking for any abnormalities or lesions. I don't see any buildup of cerumen or any discharge. Now I'm going to test cranial nerve 8 for hearing acuity. If you could hold your ear down right over there. Okay, and repeat after me.
5, 6, 7.
Okay, and your other ear.
1, 2, 3.
Okay, good. Now I'm going to inspect your mouth. Your lips are pink and moist. If you could say ah for me.
Ah.
Okay, your mucous membrane is pink and moist. Your teeth don't have any caries. Your gums are pink and moist, no bleeding. All right, good. Next, I'm going to inspect your neck. Your trachea is midline. I'm palpating your thyroid. I don't feel any enlargement. Next, I'm going to palpate your carotid arteries one at a time. Okay, now I'm going to auscultate the carotid arteries for any bruits. Okay, there weren't any. If there were, it would be from blockage or stenosis, which is narrowing of the veins. Next, I'm going to test cranial nerve 11, your spinal accessory nerve. If you could push up, shrug your shoulders. Okay, and go against my hand. Okay, good. Next, I'm going to inspect your anterior thorax. I don't see the use of any accessory muscles. I'm going to palpate your skin for any tenderness, any lesions. Your temperature is good. Your skin is consistent with the rest of your body. Your chest is rising and falling symmetrically. Next, I'm going to auscultate the lung fields. Okay. Your lung sounds were clear. I didn't hear any bronchi or crackles. Next, I'm going to inspect your cardiac system. I'm going just to palpate for any visible thrills or visible pulsations. And I don't see any. Okay. Now I'm going to auscultate the valves. Your tricuspid is at the heart of the sternum, second intercostal space. Your pulmonary is second intercostal space, left of the sternum. Third intercostal space is the Erb's point. Fourth intercostal space is the mitral valve, and the fifth intercostal space is the apical pulse. Okay. I didn't hear any murmurs or dysrhythmias. Do you ever do a monthly self breast exam?
No.
Okay. Well, it's very important that you do, and that you do it at the same time each month. If you could just follow my moves, and this is what you should do. If you put your hands above your head, put your elbows and shoulders out, and you do this in front of a mirror, okay? And then you put it on your hips. Put your elbows and shoulders out and lean forward, okay? Then I'd have you put your arm behind your head, and then starting at the outside of your breast, at the tail of Spence, you'll go in an up and down motion, covering the entire breast, feeling for any lumps, and then you squeeze your nipple for any discharge. If there are any masses or lumps or any discharge, you need to contact your physician for a more thorough exam. You would also do that for the other side of your breast as well. Then I would have you lay down, and with your arm above your head, laying on a pillow, do the same thing for each side. Now I'm going to inspect your posterior thorax. Okay, I don't see any kyphosis or scoliosis. I'm going to auscultate the lung fields. Okay, breath sounds were clear. Now I'm going to inspect and palpate your upper extremities, just testing for skin turgor, which there's no tinting, that's good. Any edema, moisture, your skin is dry and consistent with the rest of your body. I'm going to test your reflexes. This is your brachioradialis, this is your biceps, and this is your triceps. Okay? Now I'm going to inspect and palpate your pulses. This is your radial pulse and your brachial pulse. Okay. Next I'm going to test for neurological sensation. This is sharp and this is dull. Tell me whenever you feel it, if you can close your eyes.
Sharp. Dull. Sharp.
Okay, good. Next I'm going to check for capillary refill. Okay, it blanches within 3 seconds. That's good. There's no clubbing. Now if you could just do my motions, I'm going to check for range of motion. This is flexion and extension. This is adduction and abduction. Okay, good. Now if you could just push up against my hands, I'm going to test for strength. Okay, and press down. Alright, good. And I would do this for both arms. Now I'm going to have you lay down and test your abdominal cavity. Okay, if you could take a deep breath in and hold it. Okay, your contour is smooth and symmetric. You can let out now. Okay, now I'm going to auscultate over all 4 bowel quadrants. Bowel sounds are either hyperactive, hypoactive, audible, or absent. This is the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. Okay, bowel sounds were audible in all 4 quadrants. Now I'm going to palpate the quadrants for any tenderness. This is the lower right, the right upper, the left upper, and the left lower. Okay, next I'm going to inspect your lower extremities. I'm just palpating your skin for your temperature, any lesions. Skin is consistent with the rest of your body. There's no edema. I'm going to test your range of motion. So this is flexion. I'm going to test your popliteal pulse while I'm here. Okay, and this is extension. This is abduction, and this is adduction. Okay. Next, I'm going to check your pulses. This is your femoral. This is your posterior tibia, your dorsalis pedis. Okay. And I'm going to check your clonus. Okay. Now I'm going to check your neurological sensation. This is sharp and this is dull. Just tell me what you feel.
Sharp. Dull. Sharp.
Okay, good. If you can, I'm going to test your plantar reflex while you're lying down. Okay, good. And also, while I have you lying down, if your shoes were off, I would test for capillary refill. Blanch within 3 seconds, that would be normal. And if you could sit up for me, I'm going to test your other reflexes. Okay, this is your patellar, and this is your Achilles. Okay, And then also, I'm going to test your strength. If you could lay down one more time for me. And just press up against my hands. Okay. And now press down against my hands. Okay. Good. You can sit up. We're all finished. Thank you very much. Everything was good and clear, and you're healthy. Thank you.